Okay, so we're going to introduce the whole panel once again, starting from my far right, Dr. Marjorie Jameson Charles, educational psychologist, Dr. Sean Stevens, clinical psychologist, one of the past presidents of TTAP, Carol Lutchman, counseling psychologist, a member of TTAP, Lara Baden-Semper, is a clinical psychologist and is going to talk about neurofeedback, also a member of TTAP. We want to thank our panel this morning. We are going to have 5-minute presentations from everybody, and then floor is open for questions. Please get all the information that you would like to get, because all of these people have had experience in their field, so they can tell you things that you need to know. And so I'm not sure which one of you would like
She
to.
has the PowerPoint. She's at the PowerPoint, so she can. So she can go.
I just
she
have
can go first.
Notes,
Okay.
right. Okay, so we'll start with Dr. Jameson Charles.
Good morning, everybody. Okay, let me just tell you a little bit about myself. I have been in education for 30 years. I started to teach in 1983. So I was very young at that time. So education has been my field, I think my only field. I did my undergrad at UWI St. Augustine. I was one of the first psychology students when they started. So, and now I see they have a lot more students. When we started, there were only about 11 of us. And then I moved on to do a master's in education in Sheffield, and then I went on to New Zealand to continue my studies at the doctoral level. So, who really is an educational psychologist, and what do we do? Okay, so what we look at as educational psychologists, we look at the educational setting. I heard one of the students say that she was looking at doing education, and then she said that she was looking at education and she realized that she couldn't counsel the students and so on and so forth. But educational psychologists look at the impact of the educational setting and how it impacts on learning. So what we do is we look at educational intervention, how effective they are. We look at the psychology of teaching, how effective teachers are, what kind of the pedagogy, and so on and so forth. We look at the social the culture of the educational environment, the school setting. We look at leadership. We look at the culture of the school. We look at the ethos of the school. We look to see, because all of these things impact on learning and teaching. We also look at how students learn, how they develop. Okay, we usually focus on subgroups. We look at the people with learning disabilities, and we look at the gifted students. Remember, in our setting, gifted students, that's a road less traveled. Nobody talks about the gifted. You ever hear anybody talk about the gifted? But they talk about students who have learning disabilities lots, right? So the gifted students are also a demographic we look at. It is not done here, but we should do it. Another thing we look at is social and emotional problems, students with social and emotional problems. So you see, we are in terms of educational psychology, we look at social and emotional problems also. What are some of the specialities that an educational psychologist would have? We do things like instructional design. We design instruction, things for instruction, teaching, learning programs, and so on. We look at educational technology, the role of educational technology in the teaching learning environment. How we could, this is like the laptop issue, the laptop for the Form 1. As an educational psychologist, we're going to look at how we could infuse the laptop technology into the pedagogy, and how the teachers can incorporate the technology into the teaching learning environment. We look at curriculum development. How is the curriculum developed? Who does it cater for? What are some of the things what are some of the gaps in curriculum? So we look at that also. We look at classroom management. We look at special ed, and special ed is gifted, talented, those with the learning disabilities. We also look at assessment and evaluation. How does the assessment process in a particular country or in a particular state impact on teaching learning? So we would look at the national tests. I would look at the people who score below the national level, and look at what are some of the issues that particular person has, and how we can help that particular person move from point A to point B. So How do we practice? We do observations, we do interviews, we do assessment, we do consultations where we advise the teachers, we provide support to teachers, to parents, to the wider community, to younger people. We also train teachers, okay? We do learning support, and we do education. We do support in educational settings. So educational psychologists do a lot of things. Huh? You realize that, right? Good. And we find we do a lot of research also. I do a lot of research. Right now, I'm doing about four research things. One of them is on teacher efficacy. One of them is on the mature students transition into education. How do they transition? What are some of the issues that they have? Because remember, we have a new demographic of people who come into university and they are 40 years and over, they're married, they have children and everything else. So one of my research is looking at this transition theory and see what's happening with these people. So I'm doing research on 12 mature married females, the challenges, the opportunities as graduate students who have been away out of the mainstream education for over a decade and they're coming back. Why are they coming back? What are some of the challenges and how we could support them? What are some of the support structures? So this is research. I'm also doing some research on parenting. We are doing some work. We are doing some work with 2 schools where that were below the 30% mark in the national test. So we're looking at parental empowerment training at 2 schools, 2 low-performing schools in Trinidad. That's another thing we're looking at. I'm looking at and in terms of assessment, we are looking at the CAC, the continuous assessment component, and see how it impacts on the teaching and the learning experience of students and teachers. How it is, how do the teachers view them, what are some of the issues that the teachers have in terms of implementing them, and how does it affect students' learning. Okay? So what is the scope of the work of an educational psychologist? We have direct interventions with the child, where we assess the student's progress and so on. And then we have the indirect intervention with teachers, parents, and community and other professionals. Okay, so where do we work? We work in a university setting where we teach, we carry out research. We work as consultants where we design and create educational materials, classroom programs, individual educational plans. When students go to the clinical psychologist or whoever who does the testing and say that this particular child has a particular disability or something, we as educational psychologists, they usually refer them to the educational psychologist who then would prepare an individual educational plan for that particular child and then do the monitoring and evaluation to see how the child has improved. Okay? We work in the school setting and we work with the Ministry of Education. I don't know if there are any psychologists in the Ministry of Education here, but we work there too. Okay? And Dr. Moore spoke about the certification, so I don't have to say it again. And then there are professional affiliations. Somebody mentioned we have the Division 15 in APA. We have Division C in American Educational Research Association. We have the British Psychological Society. We have CANPA, which we just started. And we have TTAP. So I have all of these things here. And what is the scope? I looked at, especially in the US, what they say, the employment for psychologists in the US is expected to grow by 18 to 26% in 2014. And 1 in 4 psychologists work in the education setting. Okay, so basically that is my 5 minutes. It was longer?
It took some of mine, but
okay.
That's all right.
Okay, that's my
5+.
My 5 minutes
5+.
in a nutshell. My thing in a nutshell. Good.
All right, so I'll go next, but mine will be very brief just because part of my presentation today was going to focus on the training and education component, which we already covered on that. And then Doc over here took another portion of mine, so it's probably going to look like more like 2 minutes. But that's all right. I prefer fielding questions.
Okay.
I'm a clinical psychologist. We focus on assessing, diagnosing, treating, and preventing psychological disorders. So what does that mean? My day looks like referrals from psychiatry, referrals from GPs, referrals from other psychologists, and the folks who I'm going to be seeing typically have anxiety disorders, mood disorders, which include depression. So we get that range. I see adults, 18 and up. I would see the occasional 16 or 17-year-old. My treatment approach is cognitive behavioral therapy, right, which is one of many folks can use. And it's research-based and all this. What else? I appreciate us hearing a lot about educational psychology, because when people hear psychology in Trinidad and Tobago or counseling, they just go right to the treatment aspect. And this is important for you to understand. It's not the only aspect. The American Psychological Association, I believe, have about 56 subdivisions. So there are it's a broad profession. Psychology is. So you have a lot of different options to go to in being a psychologist. Well, I think that's it. I think that's it for me, and I'll field some questions after.
I'll go next. My name is Carol Lutchman, and